could you please clarify for the audience why have you decided to look at the experiences of people who deal with this kind of symptoms?
Okay, thanks for the question. So we decided to involve in our study participants, people who have symptoms of temporomandibular joint disorder, since there is a controversy and there is not uncertainty about diagnosing and treating these patients. Since in Armenia the gold standard, the instrument for diagnosing TMDs are not used at all. Therefore, we were sure that even if dental providers would suggest us their patients as being diagnosed with TMD, we would not be sure that these patients would represent the real TMD population. Therefore, we decided to involve and base our study on involving individuals with TMD symptoms and not TMD diagnosis.
So you mentioned, I don't remember the exact name, Fonseca
screening tool.
The screening tool.
Yes.
So it identifies
the most common TMD symptoms in general public. It's a screening tool, but it's not a diagnostic tool.
Screening tool for the symptoms.
Yes.
Mm-hmm. Could you highlight if you had any findings in your study that would be interesting for the international audience?
I find that the last finding about teeth extraction, because it was repeated by several, I can say that all dental providers who were interviewed, that they suggest their patients who have their wisdom teeth to extract them because they think that this presence of these teeth can, not presence, but extraction of these teeth can resolve the TMD symptoms, and it is part of their treatment procedure. However, on the contrary, there are several cross-sectional studies that state that extraction of these teeth is a risk factor for developing TMD symptoms. Therefore, probably it would be interesting. However, it would. I think that it will represent that there is a lack of knowledge among Armenian dentists, but it still is important and valuable, since we'll understand that there is a need to increase awareness among them about current evidence-based treating and diagnosing procedures.
Okay, I will ask a related question. So from the literature, did you have a feeling that other countries are facing a similar situation because this field is not very well developed?
I can say if you compare countries, and one of the interesting things that I found a lot of articles about TMDs coming from Iran, as Iran is a neighbor of Armenia, but they use the gold standard instrument. They try to find if there is a lack of knowledge among their dental providers. However, they are trying to follow the evidence-based guidelines and diagnosing and treating procedures that are accepted worldwide. But if we compare it with Armenia, I think that it's not comparable in this way.
So do you have a plan for dissemination of your findings among the dentists using some, your ties with professional associations or similar organizations?
Yes. During my data collection, I came up with, I collected more data which were not answering to my research question, but were really interesting. That's why I think I plan to conduct more interviews with dental providers to understand their practices towards treating and dealing with TMDs. And after that I will probably try to disseminate this information among them.
Okay, other questions or comments? Okay, thank you very much.
You.
So we're done for today. Congratulations to all 7 presenters for doing a very decent job. And we will continue our presentations tomorrow, starting here at 3:30. See you tomorrow.